Okay, thanks for joining us again at seminar. Our speaker today is Isla Shill. She did her undergraduate and master's both here at the University of Calgary and is currently a PhD candidate in the Sports Injury Prevention Research Center here within the Faculty of Kinesiology. And her research interests are primarily in injury prevention in youth female athletes, specifically sport injury epidemiology. And one of her most proud or greatest accomplishments so far is working on a systematic review to inform a consensus statement on concussion prevention in female athletes. And I think it's with rugby, right? Oh, general. Okay, well, we'll hear more about it. So thanks.
Is that, yeah, that's good. Okay, awesome. Hi, everyone. So thank you so much for being here this afternoon. I'm looking forward to kind of sharing my journey to date. As was mentioned, did my master's, I'm doing my PhD here. So I've had kind of a fun little journey that I get to study something that I'm actually quite passionate about. But without further ado, well, there we go. Just a bit about me. So born and raised in Calgary, as was mentioned, I did my undergrad, master's, and I'm doing my PhD here at the University of Calgary. I'm supervised by Dr. Emery and then Dr. Brent Hegel, who's over at the Community Health Sciences and Alberta Children's Hospital Research Institute. For my background, my master's, I did a specialization in sports medicine, and then my PhD is very sport injury epidemiology focused. So that's kind of been where I've really focused my efforts over the past few years now. More personally, I got the pleasure of being a member of the women's varsity rugby team here at the University of Calgary. So had a good 5 years, and I've also been able to turn my passion for the sport into a research and kind of career pathway as well, which is very cool. I am in the final push to finish my PhD, hoping for a spring defense is what we're going for, but I will say there's quite a few parallels in between finishing your PhD and playing rugby at this point in time. So trying to get that grind to the end. So very quick overview of rugby here. So for those of you that don't know, we're going to talk about rugby union. So this is 2 teams of 15 competing to score a try in the other team's try zone, as seen in the video in the top right corner there. However, it is a full contact sport. So in the bottom left corner, what you'll see is the defending team uses a tackle to impede the forward progress of the ball carrier or the attacking team. Within the youth rugby context here in Canada, what we see is we have a high school as well as club setting. Our high school players, they're typically grades 10 to 12, so that's about age 15 to 18, and that season will run March to June, give or take. And then our club setting, we usually see U14s, U16s, U18s are kind of the age grades. And then the club season goes right after the high school season, so June to August, because there is a rule or policy set in place where our high school players can't participate in a high school and club teams at the same time. It's just a health and safety consideration. Important things to note is that over the past, I'd probably say decade, participation rates in rugby have increased, especially on the women's side of things, which is super exciting. Our women's national team is typically ranked top 5, which is quite impressive considering they're the only top 5 team that does not have professional contracts, which is very cool. And then something important to note is that with our youth rugby players, their first exposure to the sport across males and females typically occurs in high school. So unlike hockey and soccer, where we see people starting from that very young grassroots level, they don't have that same first exposure that we see in some of our other youth athletes. Shifting a bit, because a lot of my research centers around primary prevention. Thinking of our pillars of prevention, but in a rugby context, if you will, we have training, and these are things like neuromuscular training warm-ups, tackle training programs, strength and conditioning programs. When we think of equipment is quite minimal in rugby. So there's no helmets like you'll see in American football. But we do have mouth guards. There's scrum caps that are used, which are padded headgear, if you will. And then there's also some shoulder pads, but again, very minimal padding, not like the traditional big football shoulder pads you see. And then finally, for the third pillar, we see law or policy change. And These would be things like across our different age groups, there'll be age grade law variations. So there might be different rules in place surrounding different game events like the scrum, the line out. They might have different rules surrounding the tackle, just to improve player safety across the different age groups. And then also right now, a very hot topic in the rugby player safety world is the tackle height as well. So some countries have gone to lower it to increase player safety. With this all being said, I'm gonna quickly flash our 4-step injury prevention model by Van Mechelen. You can't really have an injury prevention talk without this, but this is kind of setting the scene for my journey to date. So with our 4-step approach, step 1, we established the extent of the injury prevention problem. So looking at the burden of injury in youth rugby, for example, we'll see what the most frequent injury types are, what injury locations are injured. From there, looking at these most frequent injuries, we'll look at what the most common mechanisms of injury are. And based on that, we might develop a preventive measure that targets those higher or those more frequent injuries or higher mechanisms of injury. And then we would evaluate if this preventative measure is effective. And it goes in this nice cyclical approach. However, the caveat to this 4-step model is that it doesn't necessarily consider real world factors. So just because something in a lab-based setting does reduce injury rates, it might not necessarily mean that it's applicable to our real world context. Will coaches or players actually use it at the end of the day? And that's where the translating research into prevention practice framework comes into play by Caroline Finch. And the first 4 steps are identical. However, step 5 and step 6 actually look at understanding the intervention context and if that prevention strategy is applicable to the target population, and then also looks at the broader effectiveness. So based on my master's, PhD, and a bunch of other projects I've had the opportunity to work on along the way, I've kind of been able to hit every step, more or less, of this prevention model based on a youth rugby research program, which is very cool. So I'm going to share a bit of that journey today. For step 1, we'll look at what is the injury burden in our youth rugby players here in Canada. So this was part of my master's, but back in 2017 and 2018, we did conduct a prospective cohort study in our Calgary high school rugby players. And the season ran from mid-March to June. At the start of each session, all teams underwent baseline testing, and that included baseline questionnaires. We got some player demographic information, and then we also administered a sport concussion assessment tool 5 or SCAT 5. From there, we did injury surveillance on all players throughout the season. Every week, the players completed a Oslo Sport Trauma Research Health Center questionnaire, or OSTRAC, and that just gained the players to disclose if they've been injured or couldn't fully participate in their in rugby for the past week. And then we also got a member of the, we'll say like kind of the management team of a manager or coach to track session attendance for all games and practices for those players. When an injury or concussion occurred, we tracked it if it resulted in any medical attention or if it resulted in the inability of the player to finish that game or practice. And then if it impeded them to participate in any future sessions. So if they were gone, if they were out of rugby for a week, a month, etc. We did have study therapists that were assigned to each school, and they performed weekly visits to those schools and assessed any injuries that the players may want assessed. And we did complete an injury report form where we got all the details surrounding the injury event. And then if a concussion was sustained, the participant did get referred to a sports medicine physician here at the University of Calgary Sport Medicine Center, or we had partner community clinics they could go to as well. And then ideally the athletes were returned to play before the end of the season. Across these 2 years, we had 14 female teams with 421 players, and then we had 18 male teams of 481 players that we were following over those course of those 2 years. And what we found was in our females, they had an injury rate of 93.7 injuries per 1,000 game hours, and our males had about a 58 injuries per 1,000 game hours. And that we found the females had a 62% higher rate of injury. When we dove a bit deeper into these injuries, we found that 40% of female and then 38% of male injuries were concussions. And looking at our concussion specific rates, we found that females had 37.5 concussions per 1,000 game hours. So that's about 1 concussion occurring every female high school game. And then our male concussion rate was 22 concussions per 1,000 game hours. And that equates to about 1 concussion every 2 games. And what we found was that females did have a 70% higher rate of concussion in this cohort. Now thinking about the mechanisms underlying why we're seeing these injury rates. For our females, 70% of all game injuries and 79% of concussions were a result of the tackler, and that was either whether they were the tackler or the ball carrier. And then similarly for our males, 65% of their injuries were a result of the tackle, and then 76% of their concussions came from the tackle. What we then did is, and this is only based on concussion I'm showing you, is we compared tackle-related injury rates between males and females, and then tackler-related injury rates, and then ball carrier-related injury rates. And what I'll highlight on this slide is that our female tacklers had a twofold higher rate of concussion than our male tacklers. So that's very much potentially a target that we could use to reduce concussion in our female cohort. Branching from this pilot work that we did in 2018-2019, this was very much in alignment with Dr. Emery's Strike Concussions program. So Strike Concussions is surveillance in high school and community club sport to reduce concussions and its consequences, and it's across Canada, several sports. But we've been fortunate enough to do rugby research across 4 of these sites. So we've been collecting club and school data across Edmonton, Vancouver, Quebec, and then Calgary as well, since Strike Concussions kind of came on in 2019, but obviously COVID, we had a few detours with it. So now we're looking very much about what the burden of injury and concussion is nationally in our youth rugby players. So I just took a bit of time to describe the injury burden in our male as well as female high school rugby players. So now we're thinking what could be a preventative measure to help reduce injury and concussion, because obviously the burden is quite high. I'm going to now pivot and focus on a neuromuscular training warm-up intervention. So historically in the literature, across different sports, different age groups, neuromuscular training warm-ups are a proven injury prevention strategy. And across numerous different populations, we usually find that there's about a 36% reduction in lower extremity injury. There has been a rugby-specific neuromuscular training warm-up evaluated in high school male players. And when it was used 3 or more times per week, there's a 72% reduction in game injury and then a 59% reduction in concussion. But I will caveat is that this was an evaluation only completed in the UK, and then it was only completed in males, so we're not really sure what the link is with our female athletes. And because of the proven protective effect of these warm-ups, the International Olympic Committee consensus statement on youth athletic development actually does support the use of neuromuscular training warm-ups in youth sport. So all this being said, back in, I think it was the summer of 2019, we kind of embarked on this journey. Researchers from the Sport Injury Prevention Research Center, and then the researchers who originally developed the Activate program, so that's that rugby-specific neuromuscular training warm-up I mentioned earlier. And these are researchers from World Rugby, World Rugby, England Rugby, the University of Bath. We worked with them and our research group, as well as Rugby Canada, Sport Canada. And what we did is we pivoted to make a rugby-specific neuromuscular training warm-up that was more applicable to the Canadian context. With the Canadian context, our rugby seasons are very short. High school season lasts about 2 to 3 months, versus in the UK, their season spans about eight months of the year. It's like September to April. So they have a lot longer playing season, and they can really have this very thorough phased approach to this neuromuscular training warm-up, which our players unfortunately don't have that luxury. So we've really stripped it back and have 2 levels, and then we really focused on a net control and endurance component to get at that concussion prevention piece. With this neuromuscular training warm-up, it has about 2 to 5 exercises per component, and these components involve aerobic, strength, balance, and agility. And then, as I already mentioned, the 5th and final component is net control and endurance. So there we were, summer 2019, we developed this injury prevention program with help from community stakeholders. And I'll take a bit of a pivot now. So I mentioned with our TRIP model, we really want to think about the implementation context. So we developed this preventative measure that we think might support our youth players and might reduce the burden of injury and concussion. But we want to see that the setting, so our high school setting, is maybe ready for this intervention. And really what we want to think about is our health action process approach model to really understand the factors at play as to why someone may or may not want to use the warm-up. What the health action process approach model is, it's looking at different psychosocial constructs to understand the gap in between the intention to do something with the action. And thinking about this neuromuscular training warm-up, it's very much thinking about why players and coaches would have the intention to use it versus why they would implement it and adhere to it throughout the duration of their playing season. So what we did is, using a pre-experimental study design, we invited some coaches to a 2-hour workshop to learn this neuromuscular training warm-up. Before the workshop and after the workshop, we administered some questionnaires to understand some of these important psychosocial constructs to see if they would have the intention and action to use the warm-up, if you will. And these questionnaires were developed with some of our colleagues and researchers at the University of Bath, which was very fun to have this multi-site evaluation. With our pre-workshop questionnaire, we really focused on the intention to prevent injuries in our coaches. And then we also looked at outcome expectancies. So positive outcome expectancies would be that the coaches expected the warm-up would support their athletes and reduce injury. And then some negative outcome expectancies would be that they would expect a player that they coach this season to sustain an injury or concussion. Additionally, we also looked at risk perception at the pre-workshop time point, just to see if they associated playing rugby as a risky behavior, and so on and so forth. And then for our post-workshop time point, again, we reevaluated their intention to use the warm-up after going through this workshop. And then we really looked at self-efficacy of these coaches to understand if they had the confidence to bring this warm-up back to their players and use it through the duration of the season. At our pre-workshop time point, we were quite excited to see that 92% of coaches agreed or strongly agreed that they would use the warm-up. In terms of our outcome expectancy, they had strong positive and negative outcome expectancies. And then at the post-workshop time point, we saw that intention, 86% were slightly or strongly agreed to use the warm-up. And then coaches did display high task and maintenance self-efficacy, which is important to make sure that they really bring the warm-up back to their team. So that's a bit of working forward. And now I'm kind of more so moving into what my PhD is really focused on over the past, I guess, like 3.5 years now. So we're really looking at evaluating this neuromuscular training warm-up. So the objectives for this evaluation, and this is one of my PhD chapters. So primary objective is to evaluate the effectiveness of this rugby-specific neuromuscular training warm-up on all injury and concussion in Canadian high school female rugby players. And then the secondary objective is to understand the dose-response relationship of when players use these programs and seeing what the true effect is. So using a quasi-experimental study design in alignment with the larger Shrug Concussions project, over the past 2 years now, we've recruited high school rugby teams to partake in the study. And like the pilot, we do injury surveillance and we track their session attendance throughout the year, and then they also do baseline testing. However, the past 2 years now in our Calgary high school cohort, we've administered these train the coach workshops where coaches have been invited. They participate for 2 hours, they learn the warm-up, and we ask that they bring it back to their team. Similar to the study I just mentioned, we do still do the pre and post workshop surveys to understand coaches' change in beliefs and attitudes. And then throughout the year, when they're reporting their players' attendance, we also track whether or not they did use the warm-up. And then in addition to this, we film the warm-up for 1 practice and 1 game to see how they are using the warm-up. And then the coaches, we also do send them a postseason survey as well, so they can report, or they can self-report how they thought using the warm-up went throughout the year. So this is a larger evaluation beyond my PhD, but just to give a better idea of how we're doing this across our different sites. To navigate the Gantt chart on the screen in front of you here, the darker versions of the color are when our warm-ups were rolled, or the warm-up workshops were rolled out, and the lighter color is our injury surveillance. So you'll see back in 2022, it was only Calgary where we really rolled out these workshops. And then our other 3 sites between Edmonton, Quebec, and Vancouver, we were only doing baseline injury surveillance. And then this past year in 2023, we were able to do a national rollout of the program across all our sites, which is super exciting. For the purposes of my PhD, I'm only focusing on the Calgary specific high school cohort. So we're really looking at the pre-intervention years from that 2018 and 2019 cohort we had, and then we're comparing to our post-intervention 22 and 2023 years. And what we're seeing is we have 13 control teams, which with 409 players, and then we have 17 teams with almost 500 female players. And I'm in the process of wrapping up this analysis. I was actually hoping to present some of these results, but as any journey goes, the analysis has not been going super well to date, but hopefully some results will be on this shortly. And again, bringing this out a bit further, 2 years ago now, I want to say, maybe a year and a half ago, we were actually successful with some funding from World Rugby to do an international injury prevention evaluation in youth female rugby. So that's considering our sites here in Canada, but then we also have branched off with the University of Bath, Leeds Beckett University, and then the University of Edinburgh in England and Scotland. And we're hoping to look at the injury prevention evaluations internationally now as well. Changing directions a little bit. Injury surveillance isn't just the only thing we've kind of been working on over the past few years. We've also taken a deep dive into video analysis to really understand the mechanisms of injury and concussion that are happening in these cohorts. For our video analysis projects, we take a 3-staged approach. So the first one is match events. So when we code a game, we'll do a count of all the different events that are happening. So how many scrums, tackles, lineouts, rucks, all those different important events. And then from there, because we are working with the female varsity cohort and then our youth cohorts as well, the video is anonymous. So we do a rigorous suspected injury concussion validation. And then from there, based on the concussions that we see, we are also now coding tackle characteristics, look at the association between certain tackle characteristics and concussion. And so with our female varsity video, we've gone through our first 2 stages, and I'll be presenting on it to some of the results today, but we have our tackle characteristics manuscript under review. And then on the youth side, the first 2 stages, match events and suspected injury and concussion, are really driven by one of the master's students that was previously in our lab. And then my last PhD project is looking at tackle characteristics in the youth cohort now as well. So just quickly to pivot, or just quickly here, for Taylor Price's master's project, what she did using video analysis is she looked at injury and concussion rates across our club players, across males, females, and the different age groups. And what she found is that across our U13, U16, U18 males, there's actually no differences in injury rates across those 3 age groups. But when she looked at females, she found that both the U13 females and the U18 females had a 4 times higher rate of injury than the U16 girls. And then when she compared across the age groups between males and females, she found that the U13 females had a 3 times higher rate of injury than the U13 males. Looking specifically at concussion, it was a similar trend. Again, no differences in the males in terms of age group, but then the U13s and the U18s had a higher rate of concussion than the U16 females. And then similarly, the U13 females had a higher rate of concussion than the U13 males. For the tackle characteristics project, we secured footage from the 2017, 2018, 2019 Canada West competition. And through those 3 seasons on video, we identified 46 suspected concussions from 45 tackle events. And there were 22 concussions to the tackler and 24 concussions to the ball carrier. And what we did a case control study. So for every concussion, we matched 6 non-concussive tackles. And these were matched on the same game as well as the same team. On your right here, it is a little blurry, but this is our tackle coding template. So we do quite a few different characteristics, but for our analysis, we really focused on the list of variables in front of you. And these were chosen a priori based on the previous literature and what is deemed could potentially increase the risk of concussion in a tackle. So these are pre-contact body position, head position, speed, acceleration, where the first point of contact is, and then the tackle type. And then what I will highlight is we added a head contact intensity variable. So what this was observable deviation on video of how much the head moves due to the contact. So level 1 is just a very light contact to the head where you see the head position is virtually unaffected. And this was deemed just because when coaching the tackler typically does engage with their head. So there is some head contact. But then this would span all the way to level 4, where we see a head is totally affected and goes through significant head deviation. And then our 5th category for compression was just if the head was stuck in between the player's body and then the ground, so you couldn't see that level of deviation. And what we found through this analysis was for our ball carriers or attackers, their odds of concussion increased if the head contact intensity score was 2 or greater. An illegal tackle type increased the odds of concussion, and typically the illegal tackle type, unsurprisingly, was a result of a high tackle, so tackling anywhere shoulder above. A tap tackle also increased the odds of concussion compared to an arm tackle. And then if the ball carrier's head was down, that also increased their odds of concussion compared to if it was up and forward. For tackler-specific concussions, a head contact intensity of 3 or greater increased the odds of concussion. Having 3 tacklers in the tackle event also increased the odds of concussion. Just a lot of heads in the same space, so you're increasing the likelihood that people might hit their head. And then, like the ball carrier, a tap tackle type increased the odds of concussion compared to an arm tackle. And then finally, if a tackler's head position was away, it also increased their odds of concussion. So with this now, we are going to apply the methodology we used for our varsity cohort. We're now applying it to our high school female videos as well. So what I'll just do is I'll kind of bring this graph back onto the screen here, because if we remember, the female tackler concussion rate was significantly higher than the males. So really understanding what tackle characteristics may increase the odds of concussion in this cohort is important. So similarly, we'll be doing a similar case control study from our varsity players. And then finally, one final, I guess, project we have going on right now is looking at a tackle training program. So this has very much been driven by Rugby Canada, which is quite exciting. So Rugby Canada has recently developed a tackle training tool called Tackle Smart. And this is basically a tool that is hoping to help coaches feel comfortable coaching the tackle to their younger players. So it's really making sure that coaches who are coaching maybe a more inexperienced group, a younger group, feel comfortable showing them how to do a tackle safely. And so this is really geared around coach behavior and looking at how this tool, similar to what we do with the neuromuscular training warm-up, similar to that, seeing how through this tool, whether or not their confidence and beliefs and attitudes towards coaching the tackle changes over time. And then at the end, we are just through a pre-workshop and a post-workshop questionnaire. And then we also evaluate the postseason time point as well to see how they use that tackle training tool throughout the course of the season. So I guess kind of going through this whole journey, there's been a lot of different prevention strategies that have been touched on. But I guess the thing I really want to reinforce is that injury and concussion prevention strategies should be multifaceted given the burden of injury in youth rugby. There's not going to be one solution to the burden of injury in this cohort. So thinking about what kind of training programs, like a neuromuscular training warm-up, tackle training program, thinking about equipment, thinking about different law and policy changes that could affect and reduce injury rates is important. And then especially, there's a lot of conversations right now surrounding the safety and player welfare in rugby. So just really thinking about the implementation evaluation of different injury prevention measures is important to guide priority safe practice. And then I think based on what we've seen today, we also need to think about different sex-specific recommendations that could be made given this cohort. But I'd like to thank the opportunity to present today through this journey, and I'm happy to take any questions.
Thanks, Isla. Is there any questions?
Yeah. The first study that you did, the cohort study, where you got like the 70%.
Yeah.
Do you have the data for like I guess, people who have sustained an injury prior to their screening or testing?
So we do capture that in the injury in like the baseline questionnaires. So we do look at whether or not they had sustained any injury in the past 12 months before that, and then what their lifetime concussion history is.
Okay, and did that like,
It
you have
didn't,
like a certain amount of people who had previous concussions or anything in a certain group, or it's kind of even
if I remember, oh, it's been a while since I had the data. We looked at whether or not they had no previous concussions, 1 or 2 or more. I would say it's about 30% had had at least one previous concussion, if I remember correctly.
in both groups?
I'm just needing the females right now.
Okay.
I'm just needing the females, but yeah. Mhm. Mhm.
Great presentation, thank you. Men's Six Nations starts tomorrow.
Yeah.
What I think.
Yeah, I think that's
it's right.
yeah.
What might we see from ball carriers and tackles? Like, are there any new techniques or like things that they might be working on at that level to try to prevent concussion? I was thinking about what you were saying, some stuff about head position.
Yeah, so I think the thing right now is 2 years ago, especially in England anyways, and it's been more globally, but there has been a lower tackle height. So previously the tackle height was at the shoulder, but now nations, different ones have either lowered to sternum height or to waist height. And so I think because of that, there's a lot of navigations around how they'll approach that. Because the other piece that needs to be considered is if you keep lowering the tackle height, does that increase like knee injuries, for example, or how does that? Because the other piece is if you're lowering the tackle height, do people try to gain the advantage by going lower as a ball carrier? So I think for the Six Nations point, I think we'll kind of see maybe the tackle height play into effect a bit. But yeah.
Thanks for the presentation. I was wondering, when you were talking about the NMT, you had the pre and post surveys for the administrators, I guess. Yeah. But it went down their like agreement to use the training before and after. So.
Yeah, so thank you. It is a good point. So the 2 questionnaires that were used, they weren't totally measuring the exact same thing, but it was like a proxy for intention. It wasn't significantly different though. So the proportion slightly shifted, but I wouldn't say in that cohort it really made a difference. It stayed more same or more similar than anything else. Yeah. Mm-hmm.
In your last study, when we looked at the videos,
yeah.
So the concussion was diagnosed. So you're looking at the tackles that cause concussion, and then you try to analyze what's happening. So
yeah.
On the floor, then they were taken out.
Yeah. So with the video, because we didn't have access to the medical records of the players, it was all based on video signs of concussion. So we developed based on, it was 4 different tools. So it's concussion recognition tool, the head injury protocol assessment, HIA, and then there's 2 others based on video signs of concussion. And then from there, we actually validate these concussions with athletic therapists, physiotherapists, and sports med physicians. And then we took those concussions and we coded them for all the tackle characteristics using NAC sport video analysis software. But that's where we use the suspected concussion definition, just because of the nature of the data we're using. Mm-hmm.
I actually have the same question. Just wanted to be a bit more precise. Yeah. For your study, when you see that in your report, how do you define that something is a concussion or not?
So
what's kind of your objective criteria for that?
Mm-hmm. So there's a recognize remove protocol in rugby based on World Rugby's recommendations. So it's whenever there is a hit to the head with observable signs, and we have, I think there's about 14 or 15 signs of concussion that we go through. So we basically, if we see what is deemed as a suspected concussion, so any hit to the head, wooziness, event that could cause a concussion, recognize, remove, and then we go through the 15 or so different criteria to validate whether or not this would have met a definition.
So how do these 14 or 15 criteria, how many have to be positive before, like if 8 out of those 14 are positive, then you call it a concussion. If it's only 5, then you don't call it a concussion? Or?
No, so if it's recognized and removed, we do say it's a suspected concussion, but then we do still report on what the range of criteria was for that. Does that help a bit more?
Yeah, it seems you know, kind of a tough to define thing, and so I was just wondering how in practicality that is handled.
Yeah, so every video of the concussion is, for the varsity paper, we had three viewers of it. So we had one physio, one athletic therapist, and one sports med physician, and then an experienced video coder. So they all reviewed every concussion clip, and then they all had to deem it was a concussion based on the recognize and remove protocol. And then that's how it kind of went through the next phase, if that helps a bit.
So when people were diagnosed on these video clips as having had a concussion, were they always in actuality also removed from the game because they had a concussion, or were some of them continuing to play?
Most of them were removed, but that wasn't one of the specific. That criteria is brought, so that criteria.
Did you check when these 3 people that looked at the video, did you check and they said, yeah, that's a concussion? If the person was actually removed from the game, in how many cases? And was that a 50% case, or 100%, or 2% of the cases? Yeah,
because we did whether or not they were removed and whether or not they sought medical attention. I would say in most of the cases, I don't remember the exact portion, but most of the cases they were removed and to get medical attention. But I think there was a couple cases where they weren't removed. But I don't remember the exact proportion off the top of my head.
So a couple of cases out of how many total incidences did you observe?
There was 46 concussions.
46
Yeah.
When you say a couple, that means 2 or 3 were not removed, so about 6% or so were not removed, but 90 or 95% were removed.
Yeah, I'm just curious if there's like, is this like grading scale for video analysis of the concussions? Like, has it been kind of compared to actual incidents of concussions, like in other studies or previous work, like the reliability of the?
So we're working on doing that, that validation right now. It's just really tough to get the ability to connect the video data to exactly, because with the varsity stuff, the seasons were 2017, 2018, 19. I think we got the footage in 2021, maybe 2020. So we didn't have any of the medical records from the varsity programs, unfortunately. And then with the youth footage, it is challenging to connect the two. So that's kind of why we're exploring different avenues to do it, which is why we do the validation piece.
Okay, do other places like use the same video criteria, or is this kind of like a new?
So there is there's a professional sport signs of video concussion. So it has been looked at kind of more in the professional sport, but in the youth game, it's starting to gain traction.
Just maybe a quick follow up on that one as well. When you say validation, so if a medical doctor or a specialist can look at somebody, there is an absolute measure to say, yes, this is a concussion, yes, this is not. And what is that actually?
So based on the video or based on them getting pulled?
No, when you say validation, validation to me implies you compare it to the actual truth.
Yeah.
So that means somebody is able to decide, well, I just had a big bump to my head, now with a headache, it's not really a concussion, or it is a concussion. So so you're saying there's an objective sign that says, yes, you are concussed, or yes, you are not.
No, sorry, I wouldn't say there's an objective sign. We're still trying to work to that.
So there's no blood test, biomarker, imaging, anything that you can say, yeah, that's a concussion.
Right now for the concussions, it's all physician diagnosed, and it's all based on signs and symptoms, but we are trying to get more objective measures, like you said, across imaging, biomarkers, clinical measures is another one. but it's still trying to fit those pieces together. And we're just not quite there yet, unfortunately.
Thank you for the presentation, Isla. You might have mentioned this and I just missed it, but why are female rugby players getting more concussions than males?
And I think that's what I would love to know as well, to be honest. So I think a big part of it comes from based on just the mechanisms of the tackle. I think part of that is stemming from what's going on between a female tackle versus a male tackle is something to consider. There is also research that says that females may have a higher risk of concussion anyways. There's a few different theories, but in terms of female specific players, I think we're still trying to understand what the female mechanisms are that are increasing that rate compared to males, unfortunately.
Cool. I'm gonna follow up on Dane's question. That's a similar one. So of the characteristics of a dangerous tackle that you listed, if you had to hypothesize, or maybe you've looked at the data a little bit, what is there like one or two that you think are occurring more in females that are not occurring in males, or what do you think of those characteristics are associating with these sexes?
So there was a study that came out of Cardiff, I want to say. So they looked at a varsity population between males and females with instrumented mouth guards and video. And what they actually found is that females had a higher, they saw a higher proportion of whiplash mechanisms when it came to concussions. So I think there's something to tie into what rugby researchers leaning towards is like how females are falling. Because you can take a tackle, but it's also how are you responding to it? Are you actively falling, or are you kind of just letting yourself flop down, for lack of a better word? So I think that's part of it. I think a really big piece is like head positioning. We also, I think it's challenging because with male rugby, for example, hockey and there's American football as contact sports versus for females, there's no contact sport to lead them into that preparation. So I think that also plays a different role into it as well.
To follow up on the preparation, do females, I'm not sure what the training is for tackling in general, but do females have similar access or similar training on how to tackle versus males? Because there seems to be a discrepancy in the tackler being injured.
So I'd say it's a very like coach by coach basis, unfortunately. With the high school policy for rugby is that all players need, male or female, they need to have 10 contact practices before they can play in a game. However, the reality of getting 10 contact practices in is quite challenging because they first can officially start practicing mid-March and their games can start as early as the first or second week in April. And that's considering they have a spring break in the middle as well. So I think it's also a matter of training load when you consider it. And then a lot of what we see in this community is teachers or more teacher sponsors for the high school teams. They aren't the actual coaches, so they'll bring in community volunteers to help support, to have a safer introduction to contact and tackling in that. But it's very coach dependent, unfortunately, what the exposure to tackling is for females.
Oh, sorry. Oh, good. Sorry, I have just like another question for you. I know that in some of the other injury research, they're starting to like look into kind of that gendered aspect and like that women may be like less encouraged to engage in physical activity, strength training, things like that. Are you specifically looking into that, or do you know any like work that's doing that in concussion?
I'm not specifically looking into it, but I think for rugby, it's very needed. And I think there's a few groups that are starting to like scratch the surface of it, but I think it's still a bit too early on. But I think with rugby being a full contact female sport, I think there's such a room for that kind of research.
The warm up that you developed, is it like, how different is it from, let's say, soccer, like a preventative warm up for soccer? Is it mainly that like neck strengthening part?
Are you like when you say like a injury prevention warm up in soccer, are you thinking of like the FIFA 11 plus, like that? Yes.
Different.
Yeah. So the FIFA warm up is also neuromuscular training warm up.
Okay.
But the previous versions haven't had that kind of net control component yet.
Okay, so that's like a new.
Yeah, exactly. Yeah.
Can I follow up on that? Because I was also wondering, because you mentioned that you're developing this neuromuscular training program. Can you give an example of an exercise or two what you then would suggest as a warm-up?
So with our program, it's a lot of like isometric neck contractions. So doing the different positions is one. I can actually go back to the video. Because there is a, one of the more, I would say the ones that are, so this one here, this is actually, we call it like a bear crawl bobble. So this position, the bear crawl, is one of the most fundamental positions for rugby players. It's kind of the foundational position for scrum, line out, any sort of contact. And this is with the little bobblehead component of doing little perturbations that helps engage the neck in terms of those deep neck stabilizers in that important position. So that's another one. The other piece is, this is more so the work from like Catherine Schneider, because she's quite a, she does a lot of vestibular system exercises, but with not beyond the net control and endurance category, in our balance and strength categories, we also do some, I don't remember, it's like exercises that stimulate the vestibular system, just because there's evidence that the vestibular system is something that can be affected following a concussion. So vestibular system exercises are used to help improve post-concussion outcomes. And because these are usually prehab or rehab exercises, the thought is to incorporate them as prehab exercises within a warm-up. And those are just simple things like eye tracking. We have a partner taps one where it's, I'll be standing here and someone will kind of push you off balance and you're trying to hold your ground. And a lot of that's like eyes open, eyes closed as well, just because it's trying to navigate your body in that space without your vision. So those are a few of the things that we see in the program.
And that has been shown to reduce injuries?
That's what we're trying to evaluate. So a lot of those exercises we've kind of, they've come from different programs and different, I guess, like concussion treatment programs. But in terms of the actual concussion prevention piece, that's what we're working towards.
Many years ago, we had a very famous person here from Denmark, but I forgot her name, and she was talking about ACL injuries in the prevention programs. And what I found fabulous was that when they did the science, you know, the 2-year and follow-up and looked at a program, you know, warm-up program, they could show that they significantly reduced the number of ACL injuries. But then the study was done. Then a couple of years later, they followed up and the injuries were back to where they were before. And so it seemed to work when scientists were there observing.
Yeah.
But it didn't seem to be there when scientists weren't there. So, so are you worried about that when your study is done? You know, let's say your study shows the same thing that it creates, but now you're going somewhere else, and nobody observes the people anymore and enforces the training, that it all goes back to normal.
I hope that we've kind of set it up. I think it's inevitable that that might happen, but I hope that we've done our due diligence and like instilling in the coaches the confidence to maintain it through a lot of the different psychosocial behavior evaluations we've done. And a lot of the steps along the way that I didn't really highlight during the presentation is that a lot of it's based on community stakeholder engagement. So whenever we go through our different workshop resources or we have different handouts, we give them different support videos, we really make sure that it's an integrated approach to make sure that they're still enjoying the content as well.
So in a regular rugby game, you said you were a rugby player. When you are going into a game, how much time do you spend in warming up for the game?
For a game, I would start my warm up an hour before.
Is that long?
Well, so games are a bit trickier because traditionally you would have kind of your like more aerobic based warm up, doing your high knees, your jog, more individual based exercises you need to prepare yourself, but then there's also a kind of team warm up component. So we'll run through our plays and all that. So this warm up, when players know what they're doing and it's all said and done, it takes about 12 to 15 minutes. So the thought would be that they do that before they kind of get into their game positional based needs prior to the warm up.
No, but it's very good because sometimes when I ask this question in soccer, so people say, oh, maybe 10 minutes or 15 minutes. And coming from a track background, it's exactly that, you know, a 100-meter person whose event lasts 10 seconds, you know, they warm up for an hour and a half for 10 seconds of activity. Always amazed me how very often, I guess not in rugby, how very often in certain team sports, the warm up is very minute compared to what people in other sports.
Yeah, I would say because one of the pieces we've done with the evaluation over the past years is we did collect that footage of the warm up, so one practice and one game time point. And I would say based on the footage, most teams did start their warm up about 45 minutes prior to game time.
So why do little kids not play rugby? Why don't we start at 5 or 6 years old?
I would say it's the there's not really the same grassroots system set up for rugby players. Hockey, soccer, it's really well built up to have the proper kind of like development milestones, but I wouldn't say we have that same really built out community-based system.
So in other countries they do that?
Yeah, like I would say like in the UK for sure, they have very well like built up from like U8, U6 onwards. But we're just trying to get there at
So
the end
it's
of it.
not something inherently that people say, well, we really shouldn't do that
No.
before we are
Yeah, like
certain size.
oh no. I would say if you would ask most high school players, they didn't even really know that you could play rugby in Canada until they saw it in their high school programs. Is kind of how that works.
Looking at these pictures, I'm gonna ask you another question about your warm up.
Okay.
So what mechanisms or injuries, I think a lot of your work is looked at some of the lower extremity injuries as well. So what is the rationale or what injury are you trying to target with the strength, agility, and the balance component? Like what is the purpose of those?
It's a lot of joint control piece. So it's a lot of ankle, knee, for sure. And then some of the strength and agility, actually, we get some shoulder-based exercises as well. But I'd say it's very ankle, knee, and then a bit of shoulder.
Yes.
And follow up on this, because I felt like step 2, the etiology and the mechanism of the injury, which was to tackle, but now I understand more, like it's specific to specific joint and stuff like that. But but I like it at the end when you start talking about the head position.
Yeah.
So I felt like step 2 could be developed.
Yeah.
Like just to understand more. I know that there's the knowledge is not there yet, but I think it should like be developed in order to go to step 3 and start the prevention.
Yeah, I think what we're really hoping is with the video now, like what comes from the video analysis for the youth tackle evaluation anyways, and we're hoping that that can kind of fill in maybe some of those gaps that we did see in step 2 to maybe do a more targeted tackle prevention approach for step 3 and then so on and so forth.
I was intrigued by the fact that there seem to be age-related differences in the injury rates. I forgot now which way it went, but I think the younger females, they're more at a higher risk or more injured, higher injury rate.
Yeah, I'm just playing that.
Why? Do you have an idea why that might be?
Like this one? I think it's again, because so the U13 is the first age level that they can actually fully start tackling if they start that young. So I think part of it comes to that because it's the first year they can actually engage in a full contact tackle. I think a lot of it might stem around physical, like physical robustness and physical preparedness as well. Because we see that in the U13s, they might not be engaging in other strength and conditioning exercises beyond what the maybe U16s and the older groups are. I think part of it stems from the tackle technique. So U13s won't have a refined tackle technique compared to what you might see in the older age groups as well. But I think there's a lot of different factors at play for this, but that's just kind of the first few that come to mind.
Does one know in the U13 females what the dropout rate is between players that get injured and players that don't get injured? Could it be that those that get injured all the time, they just drop out, and then you have the more robust ones in the higher categories? It's kind of natural selection.
Maybe. I don't know. We haven't looked at it, but I think, yeah, I think so. We haven't really gone beyond this. This is all video based. Yeah.
In your U13s, are you also looking at maturity for the girls? Because around that time, you probably have a lot of different, like a range of maturity. You have late matures, early matures, right? So have you looked at that for your cohort in terms of like body size?
So we didn't do it for this study, but I think incorporating a growth and maturation component for that, especially U13, U14 age groups, I think would be really important. Yeah, but we haven't done it for the purposes of this study.
Other questions? I have one very quick and tiny. What is a tap tackle?
Yes. So a tap tackle is typically someone has like made a line break. They're running down the field, and it's not even really a tackle. It's like someone is trailing behind them, and they go and like tap their ankles, and kind of it's a bit of a diving to get them off balance. Yeah, basically. It could be, but it's more like trying to trip them up. So it's usually typically unexpected. The ball carrier is facing away from the tackler, so they don't really have that anticipation of it either.
And that one was associated with the
higher concussion. Yeah.
It's unexpected.
I think that plays into it. Yeah, because I also kind of think that links to when a ball carrier's head position was down. That also increased odds of concussion. So if your head's down, you're not really aware of your surroundings, and you can't maybe do an evasive maneuver to avoid the tackle or better prepare yourself to receive it. If that makes sense.
More questions? Okay, I think we'll end seminar there. Thanks again to Isla for a great presentation today.